Hello and good morning, everyone. My name is Dr. Annette Angsong, and I'm your board certified pediatric cardiologist coming to you on this morning. And I hope you all are doing well, that you're still working towards achieving the goals that you set for yourself earlier this year. I know as for me, I fell off the bandwagon a couple of times. But fortunately, one of my Facebook friends, she created this accountability group where you can't have any sweets, where you can't have any soda, no pasta, and you have to exercise for at least 30 minutes a day, drink 64 ounces of water. So it's good in that it's keeping me accountable to those principles, and the hope is that, I'll get back to my healthy weight. But it's helped me to realize that you definitely, when you set yourself out on a weight loss journey or any type of goal in general, that you really do need to be held accountable to someone or some group. So that would be my suggestion and recommendation for you all who are still trying to achieve healthiness. So anyway, moving along, as you know, February is Heart Month, and it's an effort to bring awareness about heart disease to the community. Because as I've said over and over again, heart disease is the number one cause of death in men and women worldwide. And this month also gives us the opportunity to bring awareness about congenital heart disease. Congenital heart disease are those birth defects that affect the hearts of newborn babies. That happens to be the number one birth defect in new babies. So the heart's doing quite a bit this month and in general. So today I wanted to talk to you about one aspect of heart healthiness called BMI. So what is a BMI? So you go to your doctor for your routine physical and they take all your vital signs. You go and sit with your doctor and your doctor tells you, hey, your BMI is high. What does that mean? So BMI stands for Body Mass Index. And to be blunt, what it tells us is how fat we are. It tells us it's an indicator as to the amount of fat in our bodies. And the way it's calculated is you take your weight in pounds, multiply it by a factor of 703, like the Virginia area code 703, multiply it by that, and then divide it by inches 2 times. So for example, in someone who weighs 180 pounds and is 5 feet 5 inches, you take the 180, multiply it by 703, and then divide it by 65 inches 2 times. So that's how you get your BMI. If you're using the metric system, then you take your weight in kilograms and you divide it by your height in meters 2 times, and you get your BMI that way. So normal BMI is 18.5 to 24.9. That puts you at a healthy weight. If you're less than 18.5, that means you're underweight. If you're between 25 to 30, that means you're overweight. And if you're above 30, that means you're obese. So that's how we calculate it in adults. In children, between the ages of 2 to 19 years of age, what you do is you take that BMI and you plot it on this percentile graph. So if your child's normal percentile for children is between the 5th and 85th percentile. And if it's between the 85th to 95th percentile, that means your child is overweight. And if the plot ends up being above the 95th percentile, then that means your child is obese. Now, what I should mention that there's some exceptions to using BMIs, such as if you're pregnant or if you're really muscular, then it might not be as accurate to use. So why is it important to know your BMI? So Dr. Nett's 3 reasons why you should know your BMI. Well, the first reason is it helps us know whether we're at a healthy weight or not. And if we're not at a healthy weight, then maybe in combination with our primary care physicians, we can work towards achieving that healthy weight. If we're overweight and obese, maybe improving the choices we make as far as what we eat, maybe the need to exercise more, maybe having a dietitian help us with our food choices. So those type of things. So it's important to know your BMI because it makes us aware. It alerts us. Okay, and like I said, knowledge is power. The second reason or important factor to know what your BMI is, it lets us know if we're at risk for chronic conditions that may lead to heart disease, such as hypertension or high cholesterol or even diabetic. Because the higher our BMI is, the higher at risk we are for those types of conditions. And knowing that, we can make the changes needed to be more heart healthy. The third reason why we should know our BMI is that it may alert us, aside from heart disease, but it may alert us about an underlying medical condition. For example, if our BMI puts us in the underweight category, is there something else going on with that person? Perhaps is there a thyroid disorder that's causing them not to gain weight as well? Or in a teenage girl, for example, is she underweight because she has an eating disorder? Or even something more sinister as cancer? Are we losing weight because of a cancerous process going on in our body? But not saying that anyone has this, but these are things that the BMI may perhaps suggest in someone who's underweight. And the same with overweight. Is there an underactive thyroid, and maybe someone is putting on weight easier than most. So BMI is a good indicator of what may be going on in our body and what we can do for our bodies if we're not at that healthy weight. So to recap, why is it important to know our BMI? So I kind of said that with my last statement, but one, it lets us know if we're at a healthy weight, if we're at risk for chronic conditions that may lead to heart disease, and it also may indicate if there are underlying medical conditions that need further workup by our physician. So before I sign off, I also want to acknowledge that this month is Black History Month. And as a tribute, I wanted to talk about physicians who have contributed greatly to the world of cardiology. And today I want to talk about Dr. Vivian Thomas. And you may have heard his story. It was in a movie called Something the Lord Made. And he was an African-American male who contributed quite a bit to the cardiac surgery world. He was born in 1910 in Louisiana. He was the grandson of a slave. And he had aspirations of becoming a doctor, of going to medical school. But then the Great Depression hit, and it completely wiped out the savings that he had for college and medical school. So he was then forced to find a job. And fortunately, there was a prominent surgeon at Vanderbilt who was looking for a lab assistant to help him with his research. So Dr. Thomas applied and got the job with Dr. Alfred Blaylock at Vanderbilt. So then later on, Dr. Blaylock got promoted as chief of surgery at Johns Hopkins University. So they moved from Tennessee to Baltimore. And Dr. Blaylock continued his research alongside Dr. Thomas in managing shock. And they received a lot of accolades for the research that they did there. Then they were approached by a pediatric cardiologist at Hopkins. Her name was Dr. Helen Taussig. So Dr. Taussig was taking care of patients who had a condition called blue baby syndrome. And blue baby syndrome, we know now, is a heart condition known as tetralogy of Fallot. If you know the talk show host Jimmy Kimmel, it's what his son had suffered back from months ago. But at that time, this blue baby syndrome was causing babies not to oxygenate well because the blood flow to their lungs was limited. And, they eventually died from it. So she solicited Dr. Blaylock's help in creating some way of increasing pulmonary blood flow so that their oxygen saturations would be higher. So Dr. Blaylock, along with Dr. Thomas, they created a shunt that helped increase pulmonary blood flow. And this was known as the Blaylock-Thomas Tausig shunt. And it is still used today throughout pediatric cardiology. It's definitely been a lifesaver in our babies that have cyanotic or are blue in general. So for that, I salute Dr. Vivian Thomas and the work that he has done for the field of cardiology. So with that, I hope you all have a good day today. Have a great week and a great weekend, and stay blessed. Bye-bye, y'all.